Okay. So alhamdulillah, we have Dr. Hassan as well as Sheikh Mustafa with us today in the program. Is going to be that Sheikh Mustafa is going to present from the fiqh perspective, from the Islamic perspective, organ donation. And that's something that every one of us see when we get our driver's license at the DMV. It asks us, do you want to donate your organs? And we have an idea that organ donation can be a life-saving thing, but does it conflict with our belief in the next life, our belief that there's a grave and that the dead are affected? You know, there's hadith about the dead being affected by someone wailing at the grave. There's certain hadith that give us some idea that maybe this is not something that we should be doing. So here to clarify those things is Sheikh Mustafa. Is going to be doing that. Dr. Hassan's going to give us the medical perspective, and then we will also have, inshallah, some time for Q&A. So if you would like to join the Q&A and put your questions up on the Q&A, you can join our Slido, and I'll put this in the chat here as well. But if you go to slido.com and type in the hashtag 54502, or just scan the QR code with your phone, then you can actually ask your questions, and you can also vote on the most important questions, the questions that you really want to see answered. So that'll help us to keep focused on the most important and relevant questions to the presentation today, inshallah. All right, so with that said, I'm going to go ahead and hand it over to Sheikh Mustafa to begin his side of the presentation. If you all have any questions, again, you can use the Slido, and you can also use the chat, or you can message me directly or in the public chat. All right, so please, Sheikh Mustafa, Jazakallah khair.
All right. Bismillah ar-Rahman ar-Rahim. Alhamdulillah, wassalatu wassalamu ala Rasulillah wa ba'd. Alhamdulillah, it's a pleasure to be joining all of you today. And I'll get straight into the topic. So this is going to be the condensed version of what I usually present. I've written a paper on it and given several presentations. Usually it takes about 2 to 3 hours. So this is like the super condensed version. So I'm just warning you about that, okay? But I'm going to try to cover it as comprehensively as I can in that time. So when we talk about organ donation, technically the term is actually organ transplantation. The word donation was added to it just to give it a sense of like a political aspect of it's something that good that you're doing. So we should try to encourage people to do it. It's almost similar to the terms of female genital mutilation, FGM, versus female genital cutting or female genital circumcision. The idea of mutilation automatically implies that it's something bad, whereas organ donation automatically implies that it's something good. It's almost like a political term like terrorism, whereas it's, you know, killing someone, terrorism becomes a political aspect to it. So anyways, there's nothing wrong with the term in and of itself, but just wanted to clarify that. So when we talk about organ donation or organ transplantation in Islam, when we talk about the word organ, it's important to understand that usually what it entails is giving a part of your body to somebody else who is in need of that. That could be a kidney, could be a heart, could be a liver, a lung, could be a cornea from the eye. It could also be skin, which we don't really view as an organ, but skin is part of the body. It could be blood, it falls under the same category. It could be bone marrow, something along those lines. So the statistics show that every 27 minutes, an organ transplant takes place somewhere. And every 2 hours and 24 minutes, someone dies waiting for an organ that had they gotten it, you know, from the will of Allah, of course, but they could have potentially had their life saved. So this is important data to keep in mind. And one of the other things to keep in mind is that a 2017 study showed that in the USA, there were 34,770 transplants, and out of those, there were 7,000 deaths in that year of people waiting for a transplant and they died. So this is not only throughout the world, but this is also a problem in the United States. But looking at that data, it's also important to remember that 80% of the people who died from those people were waiting for a kidney. Why is that significant? It's significant because we're going to be covering two aspects of organ transplantation. One is from a living person and the other one is from a deceased person. And there is a slight difference between the two. So keeping in mind that 80% of the deaths that we're talking about were actually could have been resolved from a living donor, something to just keep in the back of your mind. So why do people donate? and why do people not donate their organs? There's about 7 main reasons why people, or 7 reasons that affects people's attitude towards organ transplantation or organ donation. Number 1, if they're giving it to a family member, they're more likely to do it as opposed if it's somebody else. Number 2 has to do with the culture and kind of, what does the culture say? If you're in a culture where it's just promoting the idea, you're more likely to do it because you're influenced by your culture. And if you're in a culture that is against it, you're more likely to be against it or be disinclined towards it. Number 3, there's family pressure. Oftentimes happens. If your family member needs something, the family comes and pressures you. Hey, you need to give your kidney to, your mom, your dad, your uncle, or something like that. Number 4, the body integrity. People are afraid of what's going to happen to their health later on in life. Number 5, their attitude towards the healthcare system. Do they generally trust the healthcare system, or they're quite skeptical about, hey, there's, these big pharma, they're doing all these, crazy things. We're not sure if we can trust them. Number 6, fear of early organ retrieval, which is basically the concept of brain death, which I'm going to be covering. This idea of, what if I'm on like life support and they just like kill me off because they want to take my organs, right? And number 7 is religion. So this is the part that we're going to be focusing on in this lecture today, is that religion is not the only factor that determines whether or not someone is going to be inclined towards or disinclined towards donating their organs before or after death, but it's one of the 7 factors. And Islam is not the only religion that says something about it. Some of the religions that are very critical of organ donation, you have Native American religion, Roma Gypsies, Confucians, Shintoists, some Orthodox Jews, Buddhists, because they say it disrespects the bodies of their ancestors and it disrespects nature, and Jehovah's Witnesses, because they say that the Hebrew Bible, the Old Testament, prohibits blood transfusion, so the organs must be drained of blood, which is, really usually not that likely. So there's a religious aspect, and then there's a few main secular moral aspects to it as well. And there's 4 main things. Number 1, respect to the dead body, or is the dead body being disrespected through the process? Number 2, the issue of brain death, which I'm going to cover. Number 3, selling organs. Is that moral or is it immoral? So the majority of people say it's immoral, but I'll cover this in more detail as well. And number 4, the concept of cloning. So this is a bigger issue for the future, but people, if you watch sci-fi movies and stuff like that, people are going to be cloning others in order to use their organs in the future. And the concept is, if the clone has a soul, are you going to be, taking somebody else's organs? Just you clone them for that reason, just for yourself. So rich people are going to clone themselves. And then if they ever need an organ, they'll just be like, I got a few clones. It's like a emperor in Star Wars or something like that. He's got a bunch of clones, right? So this concept is a moral issue as well. So what does Islam say about it? There's 2 main groups of Islamic texts that talk about this concept. First, we'll talk about the ones that indicate that organ donation is not something that's going to be allowable. Among these texts, you have a verse in the Quran which says that we have honored the children of Adam. Okay, and we're not talking about Sheikh Adam here in this lecture. We're talking about the children of Adam as a whole, meaning we have honored all human beings. Karamna bani Adam. So there's a nobility to the human being, and if you try to mess with a human being, whether their body living or dead, whatever it may be, that's like disrespect to the human being. Number 2, there's a hadith in Sahih al-Bukhari, it's authentic, where the Messenger of Allah, he used to encourage giving charity, and he forbade muthla. And muthla means mutilation of a body. So even when soldiers were on a battlefield or something like that, after the body dies, you're not allowed to mutilate the bodies, no matter how much you hate the person. If you need to throw them into a well or something like that, you don't like chop them into pieces or something like that. It's considered to be disrespect of the body, regardless of who it is. There's another hadith in Sahih Muslim, in the same category. The Prophet, peace be upon him, he said, refrain from muthla. So do not go near mutilation at all. There's another hadith in the Sunan of Abu Dawud, Ibn Majah, and the Musnad of Imam Ahmad, which is considered to be sufficiently authentic, where the Prophet, peace be upon him, said, breaking the bone of a dead person is similar, meaning similar in sin, to breaking the bone of a living person. So that's like basically, if you mess with the dead body in some way, cutting it up or something like that without some need, that's like the same way you're harming a living body. So you don't do that. And then there is an explanation of this. Imam Tahawi says in Sharh Mushkil al-Athar, he says that this hadith shows that the bone of a dead person has the same sanctity and honor as the bone of a living person. So scholars made the clear explanation that this is what this hadith is indicating. There's another hadith in the Musnad or in the Sunan of Ibn Abi Shayba, the Musannaf of Ibn Abi Shayba. He said, harming a believer after his death is similar to harming him in his life. Same principle, right? And the last hadith, which is very relevant here, is a hadith in Sahih Muslim where the Prophet, peace be upon him, said, Allah's curse is on a woman who wears false hair. Right, so this idea of wigs and stuff like that, yeah, just short answer, if you're going to ask me, yes, it's okay to wear a wig as long as it's not made from human hair. So the question is, well, why was this human hair forbidden for women to wear? Why are they allowed to wear animal hair wigs or synthetic hair wigs? They're not allowed to wear human hair wigs because you're not supposed to be utilizing something that comes from another human body, right? And of course, like L-cysteine, that's inside your bread and stuff like that, coming from human hair from China, that's a whole nother issue. We're not going to get into that. But this is this idea, these are some of the texts that are talking against organ donations, and this is what scholars have quoted. Then there are texts that are for. The texts that are for is basically two. Number one, it says, whoever saves the life of a person, it's as if they've saved the life of all humankind. So meaning if you can save somebody's life, this is something really big in Islam. And the second text is the one about necessity. So Allah says in the Quran, in Baqarah, Surah Al-Baqarah, chapter 2, verse 173, He says, Allah has only forbidden to you dead meat and blood and pork and whatever the name of Allah has not been invoked upon that meat. But if one is forced by necessity without willful disobedience nor transgressing the due limits, there's no sin upon that person. So basically, you're not allowed to drink blood. You're not allowed to eat pork. You're not allowed to eat carry on dead meat. But if there's a necessity, if you're forced by necessity, are you allowed to do it? The Quran is very clear. Yes, you are. In order to do what? In order to save your life. So if you need to save your life, if you're allowed to eat pork, and if you're allowed to drink blood, I don't know how blood would save your life, but if you're allowed to drink it for whatever reason, for some reason, you're allowed to go ahead and do that. So if you're forced by necessity. So based on that principle, it all comes back down to this concept of, to what level is it necessary, and to what level do you actually have an exception being made? So let's talk very quickly about the history of transplant surgery and the fatwas that have already come out. This is not like a new topic, but it's new enough to see that the research in this field is developing over time. So history of transplant surgery, from what I've found, in 1869 was the first skin transplant that took place that we know of. Now, probably Muslim scientists were doing it like, 1,000 years ago or something. They were pretty advanced. But from what we generally have in medical literature right now, this is the first one. 1906 was the first cornea transplant. Right? The reason why I bring this up is because you're not going to see Muslim scholars prior to 1906 giving a fatwa about organ transplantations because it didn't exist. Right? It just simply didn't exist. So why would they talk about it? From 1906, you have almost nothing until 1954.
So we don't even have hypotheticals. We don't have hypotheticals from the scholars.
We have a few hypotheticals, but not what we're talking about specifically. There are hypotheticals where, like, if you're starving in an island somewhere and your friend is there, can you eat your friend to save your own life? That was a big issue of discussion, right? But this idea of putting another organ or something, few hypotheticals, but not actuals that we were looking at here. So 1954 is the first kidney transplant, right? And people, the reason why I'm bringing this up, it's important. People are like, well, Azhari scholars from Al-Azhar University, they were there, from the early 1900s. Where were their fatwas about organ transplantation? Why are they so late to the game? They're not late to the game. This simply didn't exist, right? The first transplants happening in 1954. 1962, first kidney, lung, and liver transplants from deceased donors is happening. 63, the first organ recovery from a quote-unquote brain-dead donor, and I'll explain what that means. 67, first liver transplant. 67, first heart transplant. 68, first bone marrow transplant. 1968 was the first definition of brain death that ever came up in an ad hoc Harvard committee at Harvard Medical School. 1976 changed things a lot because they discovered cyclosporine, which basically had the ability to suppress the immune system, which would prevent the rejection of transplanted organs. Now the industry becomes something where, hey, it's becoming popular. So what you're going to find now is, hey, this is something significantly different. Now we're going to get a lot more fatwas coming out after 1976 because it's actually being applied on a massive scale. 1990, first living donor lung transplant. 1998, first hand transplant, right? 2010, the first full face transplant conducted in Spain, right? And in 2019, this was just 2 years ago, right? The Medica Journal of Clinical Medicine basically made the argument that a head transplant was assumed to be impossible, but we think it may be possible. So there's been an instance of a guy who signed up to basically have an entire head transplant, one person's head transplanted to another person, right? So now it's like, you know what? We need fatwas on, like, you know, are you allowed to like transplant one person's head to another? But it's not happening because people believe it's impossible. So it's been scheduled for about 4 or 5 years. When I brought this up to the Fiqh Council of North America, they're like, why are we even going to discuss this if it's not even happening? And in fact, the guy backed out. Now you can read about it, you know, if you get time. But the point is, there's a lot of questions that come up. So the literature is changing. The fatwas are changing because the technology is changing, and there's even moral issues about, you know, when are you not you anymore? If you have like a part robotic arm and you have somebody else's head in the future, you have another leg or something, where do you define what you are? It's like a sci-fi movie. You just have like a brain and a metal body or something like that. So this is why you have I'm about to present some fatwas to you, and I want you to understand why the fatwas differ and why there is continued discussion on this topic. Sometimes we just come across and like, why can't the scholars just give us a clear answer? Because it's not such a clear science. It's not such a clear issue, even from the perspective of science. So I'll explain that to you. So there's some pre-modern fatwas that came out from scholars in the past, right? And the reason why they're significant is that whenever a Muslim scholar, before they go to the Quran and Sunnah, or while they're going to the Quran and Sunnah, they want to try to look at what previous intellectuals have said about similar topics. This is something that everyone does. So when moral philosophers today are deciding whether selling organs is moral or immoral, they're going to go back to philosophers like Aristotle and whoever, Aquinas, all of their predecessors, Descartes or something like that, and they're going to say, well, what did they have to say on issues like this before we formulate our own thing? So Muslim scholars do the same thing. They don't just go to Quran, they don't just go to Hadith, they go back and they look, say, what did other Muslim scholars throughout history, how do they view issues that are somewhat similar to this, so we can get a conceptualization of this. So there's a few fatwas that are pretty significant in this. One of them is a fatwa coming from Imam Abu Hanifa, which is documented in Samarqandi's book Tuhfatul Fuqaha. It's like 1,000 years old. He basically says, if a pregnant woman dies and the child in her stomach is still alive, question is, should we cut open her stomach to take the child out? And he says, yes, you should. Why? Because the reasoning is, you're saving the life of a human being. The sanctity of the human being, of the mother's body, will be overlooked. So you should cut open the dead mother's body in order to save the child that's inside. Very similar to the explanation of organ donation that's taking place today. Number two, Imam Nawawi in Al-Majmu', he talks about teeth transplants and bone transplants. Now, teeth transplants were probably happening. Muslim scientists were very advanced. It's possible that even some type of bone transplant was actually happening at the time. Imam Nawawi is not known to be someone who theorizes a lot. That's more of the Hanafi school. So he's a Shafi'i school. Yet at the same time, he's discussing issues like this. You have another fatwa coming from the Hanafi school as well. This documented in Fatawa al-Hindiya. He said, if a person feared death due to hunger, and another person said to him, you can cut off my hand and you can eat it. So the Hanafi school said, no, you're not allowed to do that. It's impermissible for a desperate person to cut off a part of himself and eat that. The Shafi'i school said, you know what, you can do that. Now, some of these discussions sound weird to you, but the point is that these concepts were kind of discussed to establish a framework of what are the limits to the exception that's mentioned in the Quran about when there's a need, when there's a necessity in order to save life, etc., etc. So you find stuff like this. So with that, you have a whole list of fatwas throughout history that discuss this issue. So what I'm going to do is I'm just going to quickly share my screen for a second so you can see it. I had a presentation, but I decided to skip the presentation. So you can hopefully see this here on your screen. So you got is that's actually not the one I wanted to show you. I read this to you already. This is the history of transplants. This one right here. So you can see there's a chronological summary of official fatwas regarding organ transplantation. So you have in 1959, you have the Grand Mufti of Egypt talking about organ transplants. But what does he talk about? Cornea transplants. So when you read that, the first time I read that, I'm like, why could they talk about anything else besides cornea? Because that was the forced transplant that came out. Then you have all these other fatwas coming out across the board, right? And if you look at where they are all the way going through, the majority of them in principle are that organ transplantation is permissible. You have only two main exceptions. One of them is in this list. It's Muhammad Shafi' Uthmani, who's the Grand Mufti of Pakistan. And the second one, who's very prominent in this, is a very well-known Egyptian scholar by the name of Subhanallah, his name eludes me right now. The famous tafsir, the one who did the tafsir.
Sha'rawi.
Sha'rawi, thank you. Yes, Sheikh Sha'rawi, very famous, well known for his tafsir programs and all of that. These two scholars are among the most prominent opponents historically of organ donation. So we'll get back to that anyways. So there's many fatwas coming out. The most prominent fatwas that were pro organ transplantation were by the IIFA, Islamic Fiqh Academy of the OIC, and the Islamic Fiqh Academy of the Muslim World League. So one of them was given in 1988 and the other one was given in 1987, which basically says that live donation, a living donation, and cadaveric donation, meaning deceased donation, is allowed in principle. The Muslim World League said the exact same thing. So then you have two main bodies of international scholars where they come and they meet. One of them was in Jeddah, one of them was in Mecca. They had international scholars come together and basically say, yeah, this is going to be allowed. The ones who were against it were the more popular scholars in their own areas. Mufti Muhammad Shafi', as I mentioned, Grand Mufti of Pakistan, father of Mufti Taqi Uthmani today, who doesn't agree with his father's fatwa, but doesn't issue a different fatwa on the thing. He just abstains and doesn't have an opinion, last I checked. And then Sheikh Sha'rawi in Egypt, right? He actually came on TV and during a very famous television interview, they asked him about, what do you think about organ donation in Islam? And he famously answered, he said, how can you give a kidney that you don't own yourself? You don't own this, doesn't belong to you, you cannot transfer it. So now you find that like so many people started, he was such an influential person today, and he's like Sheikh Umar Sulaiman, Sheikh Yasir Qadi of like his time, Mufti Menk. So like these people are way more influential to the masses of Muslims than somebody like the Muslim World League whose fatwa is going to sit in a book and it's going to be like well researched, but it's not necessarily going to be the most popular fatwa. You also have Grand Ayatollah Sistani in Iraq. He said that it's not permissible to remove any organ from a dead body of any Muslim in any way whatsoever, which is different from Iran's Shia stance and position. The last one I'll give you is some people who changed their mind. The Islamic Religious Council of Singapore in 1973, they said that it is not going to be allowed. Organ donation is not allowed. And then after reconsidering their fatwa and medical advancements happened in 1985, they said, we have changed our position, we have changed our mind, and we've revised our fatwa, and we've said that actually it should be something that is allowed. So continuing on, so there's also a lot of political pressure.
Brother
By
Hazim,
the
do you
way,
have a question?
By the way, Sheikh Sha'rawi also changed his opinion, and there is like evidence on that actually, but that's contested anyway. But there is this opinion that he did change his opinion.
Okay, inshallah, send me that research please afterwards, inshallah. But this is a well-known opinion generally. So yeah, there's political influence as well. So for example, many Muslims in Europe, in the UK, for example, they follow the fatwa of Mufti Muhammad Shafi'. And what ends up happening is that they're kind of have a negative attitude towards organ donation. Because of the rise of Islamophobia, they're basically that you have people who hate Islam saying, why should we allow them to receive organs if they're not going to give their organs or sign up for any donor card? So now it's almost used as a tool of Islamophobia against Muslims in Europe who don't want to, or who have concerns and reservations about actually engaging in organ donation. Anyways, let me move on for the sake of time. So there are a few important issues that come up when it comes to this issue. Number one is it's allowed. The people who said it's allowed, they said conceptually. Conceptually allowed, assuming all of these other conditions are met. Number one, there's a genuine medical need and there's not going to be any harm that takes place. So it's haram to transplant an organ on which your life depends while you're living. So if you transplant a heart from a living person to another person, then the first person will die. Even though the other person will live, this is not going to be something that's allowed. It's haram to transplant an organ from a living person if it's going to cause an essential function of theirs to cease. So for example, if you take the cornea of both eyes and transplant it to another person, an essential function is being able to see. So now you've removed that essential function that the person has. This will not be something that is permissible. The second is absolute respect to the human body. So the process of transplanting an organ must uphold the dignity and honor of a person, living or dead. So to give you an example, there's some horror stories that happen. So the one Muslim family whose son signed up to be the donor on the license, they said, okay, he signed up to be a donor. We're going to go ahead and, take his organs. And what ends up happening is the family got back like a lump of flesh with like pretty much no bones left, just like skin and just flesh like this in like a bag or a box or whatever it was. And they couldn't believe it. And they're like, how are we supposed to have a janazah? This wasn't supposed to happen. So there were some policies in place in some states, or I assume in most states, that this is not supposed to happen. But this happened to at least a family and they couldn't believe it. And they're like, had we known, we would not have allowed this to happen. There's also another issue that happened among many people. One of them is George Eisenbeis. He died in 2011. And the family sued an organization, and they said that the California Transplant Donor Network pressured them into donating the organs of, their deceased relative. And then they said they mutilated the body so badly that we couldn't have a proper viewing at the funeral. So they were suing them for damages for mutilating the corpse, for medical battery, for fraud, for willful misconduct, for negligence, breach of contract, and emotional distress, right? So this is where some of the concerns come. And I mentioned that how much people trust the medical profession as a whole in general, and what level of what level of problems are there in that system. I'll come back to anyways later on. The next one is no reproductive organs. Reproductive organs cannot be transplanted. Anything which is going to carry the genetic inheritance from the donor, all right? But transplanting other internal sex organs would be allowed. Explicit consent. So this is an issue about who must consent, right? So the donor in Islam, according to most of the fatwas, the donor must explicitly give permission to donate the organ, and it's not something that can be done by relatives or by somebody else. Whereas generally in many states in the law, that it can be done by somebody else. It doesn't have to be done. So Kuwait Fatwa Council in 1979 said that it can be done without consent. That was the one dissenting fatwa that took place. So that's a pretty big issue. The next one is no compensation whatsoever. So the majority of fatwas all said that you cannot sell any organ at all in any way, shape, or form. And this is a big issue because in 1999, eBay, when eBay was big and the tech boom and all of that, someone put up an auction for one functional human kidney. The highest bid got up to $5.7 million, and then eBay had to take it down because it's illegal to be selling, organs. No, I'm not sharing right now at the moment. I just shared that one slide. In retrospect, maybe I should have, but it's too late now. So selling kidneys is a big thing, but here's something that people don't know. There's a loophole in US law. In US law, there's a 2012 Huffington Post article titled Abusing the Gift of Tissue Donation. So basically, they said families don't realize that when they okay a donation to a nonprofit organization, such as the California Transplant Donor Network, I'm researching for California specifically, they said what people don't realize is that the tissue that is recovered from the body routinely goes to for-profit companies, and they feed $1 billion industry that uses those tissues for everything from repairing a knee to plumping up a penis. This is Huffington Post quote. So basically it says few states require that companies will tell families that their loved one's tissue is allowed to be sold overseas, sent to a for-profit company, or used in cosmetic procedures such as wrinkle fillers and nose jobs. So this is very problematic. It's a 2010 study that showed that 70% of donor families said that they would have objected to donor organ donation had they known that the tissue of their deceased relative is going to a for-profit business. So Muslims should not be naive. They should understand, what are the laws and what are some of the loopholes in the law, which brings us to the state of Iran. Iran is the only Muslim majority country that allows monetary compensation to donors, right? So I can't get into that due to matters of time, but anyways, that's in one of the other conditions. And then brain death, and I'll conclude with brain death, and I'll summarize the fatwa because time's pretty much up. So the idea of brain death is if there's irreversible coma, that you're gone into a coma and you're not likely to get out of that coma. Is brain death death? So the question is, if you die, if you're dead, your organs can be taken out. That part is clear. But if you have gone into what's called brain death, but not cardiac death, if that definition is acceptable as being death, then it's okay to take out your organs because you're already dead, assuming that you allow for the live and the deceased organ donation. If you don't consider it to be the definition of death, the Islamic definition of death, then it becomes very problematic, because your removal of the organs is what actually caused the cardiac death or the real death of that person. So this concept of brain death is something that is highly disputed even in the medical community. Why? Because there's a difference between, from a medical perspective, the difference between a prognosis of death and a diagnosis of death. And a prognosis basically means it's a guess to the outcome of what the treatment is going to be. And a diagnosis is identifying the problem and giving it a name. The two are not the same. So this is something which, several fiqh councils have actually debated. And when they looked at the research again and again, they've come back and they said, well, we just assumed that the medical community was clear about brain death being death, but actually it's not. There's a lot of research that kind of puts this in a gray area. So with that, let me just give you the conclusion of the Fiqh Council fatwa. After 3 years of discussion, in December of 2018, they basically gave a bunch of conditions. And I'll read those conditions to you, and then maybe during the Q&A I can answer more questions.
This is Fiqh Council of North America.
A Fiqh Council of North America, yes, which is very similar to all the other fiqh councils, with one major exception, and that is all the other fiqh councils mention that it can only go from a Muslim to a Muslim. The Fiqh Council of North America did not put that condition in there, so I just want to throw that out there. So here's what they say, a few points. Number one, organ donation, transplantation is permissible in principle. Number two, it's an act of charity when you have a good intention to do it. Number three, the condition is you're not allowed to sell any organs. Number four, condition is there should be no harm to the donor and no harm to the patient, or it must be minimized to the absolute necessity. Number five, the informed consent of the donor is a requirement. Number six, no vital organs while the person is living should be given up, which is an issue with the whole brain death thing, whether they're living or they're not living yet. Number seven, or whatever number I'm on, the deceased donation should be done after cardiac death, which is cardiopulmonary cessation. So this was put into the fatwa, and they said, we are giving this fatwa out of a precaution of uncertainty, and we're calling for more research to be done on the concept of brain death. So that is what was issued recently in 2018. So they've taken basically a tawaqquf. We're not going to make a clear-cut stance on the issue of brain death decision. Number whatever I'm on, no reproductive organs, ova, sperm, uterus cannot be transplanted. And they said when it comes to face and partial brain transplants, we have no opinion right now we leave that up to further research as well. So that's pretty much the conclusion. Hopefully that clarifies some things.
Okay, Jazakallah khair for the very informative presentation there. I also wanted to give Dr. Hassan a chance to follow that up with anything. I think you wanted to talk about a few things before we get to the Q&A here, inshallah.
Assalamu alaikum, everyone. I'm Hassan. My qualifications, the kind of the basis on which I'm talking, I'm an anesthesia and ICU doctor here at Swedish Medical Center. So deal not uncommonly with issues of death, people passing. So I'm just going to say a couple of things and we'll leave it to Q&A because I'd like to be available to see what questions, if you guys have any questions for me, but I imagine that most of the questions are probably for Sheikh Mustafa. I think the first thing that I'll say is brain death in the United States of America is equivalent to death. And if someone is declared brain dead, they are considered to be dead. In the United States, the UK, whatever, those are basically the guidelines that I'm familiar with. What is brain death and how do we decide what brain death is? And how is it different from what Sheikh Mustafa was saying, the prognosis of death? Prognosis of death is when we consider someone that has a very severe brain damage. Essentially, the different parts of the brain, the top part of your brain, the cerebrum, is more involved with complex thought, processing, and things like that. To very oversimplify things, the brain stem is more involved with reflex actions, things that you're not consciously in control of, but controls like your breathing and things like that. The examination or the decision that someone is brain dead as opposed to having severe brain damage is a very specific examination that's recommended to us. So we do a brain death exam. There's two physicians that carry a large amount of things to make sure that there's no conscious thought and that there's no brainstem reflex.
I think you muted yourself, Hassan.
Sorry about that. I was saying, so there's a very set criteria, a set exam that we have to do to declare someone to be brain dead. Once they're considered to be brain dead, that they're considered to be dead. And that's considered to be an unrecoverable injury. That's that there's no chance that they're going to be able to come back from this. There's a lot of space in between a very bad brain injury and brain death. Someone that can have a very bad brain injury, for example, their heart stopped from a drowning, say, for example. And doctors could tell you, we do not think that this patient is ever going to wake back up. But unless they meet very specific criteria, we will not declare that patient to be brain dead. We can say there's an exceedingly rare chance that they will ever have, that they're ever going to wake back up, or to have a very, very low chance that they're going to be able to talk or recognize people or anything like that. People can make guesses and the prognosis is what they said, but declaring brain death is a very set rule of criteria. And I consider that to be that someone is dead, they're no longer alive, that there's no chance that they're going to be able to wake back up from that. It's confusing because there is life support machines. We can even continue to keep someone alive when their heart is stopped nowadays. There's machines that can externalize the heart, so to speak, and you can not have a heartbeat and still be alive. So there's a lot of kind of philosophical questions about when is someone alive, when is someone not alive, that I defer, to the scholars. A couple of just quick questions that sometimes people have about organ transplantation. One, the majority of organ transplants in America are donated from people who have passed, either death by brain death or cardiac death. Cardiac death is a lot more tricky. For someone who is brain dead, we have after, usually it's a car accident where they hit their head or their heart stopped for whatever reason. And that led to having a very bad brain injury to the point of brain death. What happens is that the body is still alive and it's preserving the organs, okay? The organs can't live after the heart has stopped for a long time at all, okay? So it's actually, there's very set criteria. If someone has cardiac death, their heart has died, their heart has stopped. Within 30 minutes, those organs, that's a very different situation because those organs lose blood supply and they can die very quickly, and it can become much more risky transplanting those into another person. There's a higher risk of failure of that. So the majority of organs are transplanted from people who underwent brain death. And then there's organs that people that are still alive also donate. So one question that people ask is, how do I get matched with someone else? The entire concept comes from anything that is not from within your body recognizes it as being foreign and as an invader and attacks that. Your immune system attacks that, right? So if someone transplanted another person's organ into me, my body would recognize that as being foreign and my immune system would attack it. And that organ would be rejected. So like Sheikh Mustafa was discussing the discovery of cyclosporin and other immunosuppressant drugs, what we found is that we can suppress the immune system to not attack that organ to decrease the risk of rejection. We don't want to suppress it too much because then you become susceptible to infections. So what they try to do is they try to find people who have some genetic matching so that there's more compatibility, so you don't have to immunosuppress them as severely, okay? So if you are interested in donating to someone else who's got, kidney problems, that's what they'll do is they'll do a series of tests to see if there's genetic compatibility. Usually people who have similar genes are more likely to be compatible. So people within your family, people within the same ethnicity as you. And that's why people say that it's important to have a diverse range of people, diverse types of people on the organ donor list, because it's easier to find someone that's compatible for an organ that someone else needs. Okay, once someone gets the organ, they receive an organ transplantation, they are on lifelong immunosuppressant therapy. Okay, so before they may even consider someone to be eligible, they make sure that you have the social support, that you're compliant with your medication, that you understand that things are going to be very difficult. It's not a very easy life. People are prone to infections afterwards, continued medical checkups. They do biopsies of your organ that's transplanted after to see if there's rejection or not. So there's a lot that goes into living with an organ that's been transplanted as well that people have to consider. And the last thing I'm going to touch briefly on is something called the organ donor list. So say if I have kidney failure and I'm waiting for a kidney, nobody that I know is donating me their kidney. How does it work? How long do I have to wait? Who gets it? People think that it's like a grocery store, that you're on the list and then the first person gets it and then the second and the third, but it's actually a very complex set of criteria based on how long you've been on the list, how severe is your disease. They want the organ to go to someone who, if you're generally healthy and you just have one organ that's injured, and you're young and they think that that organ is going to be able to last for a long time in that patient, they may prefer to give it to that person. Or if someone is very sick and they're in immediate risk of dying without that organ, they'd rather give it to that person as opposed to someone who is going to be able to wait 2 or 3 years, they think, and still do okay. They also look at proximity. So an organ, once it's removed from the body, can only remain viable for a very short amount of time. So they're going to look at people in the same geographical location who have a match, who the size actually matches well with, that's all those kind of criteria that go into deciding how an organ is allocated to a particular person. And I'm going to stop there and leave it to Q&A, because I imagine most of the questions that people have is really for Sheikh Mustafa.
Jazakallah khair, Dr. Hassan, as always, for your perspective there. Sheikh Mustafa, Dr. Hassan, we're going to go ahead and move on to the Q&A here. For those of you who have questions you want to add, please add to the Slido, and then we can vote on the questions as well, so that in case we get a lot of questions, then we're able to go to the most relevant ones and the hottest questions first, inshallah. So Umar asks a question here. For Sheikh Mustafa, how do we reconcile between the fatwa that organ donation is permissible with the reality of agreeing to be an organ donor on our driver's license? It seems like the fatwas have specific restrictions which the DMV agreement may not support. For example, the for-profit companies, lack of respect of bodies, donation of sexual organs. Are we still permitted to agree to organ donation on our driver's license?
Okay, yeah, so this is probably like the most common question that we get asked. And it's not an easy question because, first of all, every state has its own policies and its own guidelines. So this is on a state-by-state basis. And what we did was we had some people go and research this in different states. And turns out that the policies are different across the board. So the general rule is that if you are able to put conditions, so one of them checked in the state of Wisconsin, you're able to specify which conditions you want when you're added to that list. And those conditions have to be upheld. So if you're in a state where you're able to add those conditions that you have and they're actually going to be upheld, then it's fine to do that as long as the conditions are in place.
Are
In
there
terms-
other ways to add yourself to the donation list that is not the DMV?
So yeah, that's a question we could not get answered. So we had the National Transplantation Network attend our meeting. We had two of them attend our meeting. And when we tried to ask these specific questions, they simply refused to answer them. They just basically didn't want to answer them. So it was kind of frustrating that we couldn't get clear-cut answers from, because they were searching for a particular fatwa that they wanted us to give. And we were not, that's just not the way we work. Like, you shouldn't be putting political pressure or whatever pressure on an organization to get the answer you want. So we couldn't get a clear-cut answer on that. So we can't answer that. Someone else should be able to do the research on that and answer it for us.
Okay. Question here on the Slido: can a Muslim woman donate her organ to a male? To a
A
male.
Muslim woman donate her organ to a man. Yeah, that's not a problem. Between men and women, this is not like a concept of like hijab being violated or something like that. No, there's no issue there.
Okay.
From an Islamic perspective.
Got it. And can you specify this on your will, on a DNR form, do not resuscitate form, or something like that?
Specify what?
That you'd like to be a donor, just in response to, is the DMV the only place? I suppose.
Gotcha. I mean, that's not a question that I would answer because it's on state by state. But it's from an Islamic perspective. Yes, adding that to your will is perfectly fine. That comes under the category of wasiyah. Wasiyah is a bequest. Bequest not only applies to how much money you leave behind for certain causes, up to 1/3, but you can also put a wasiyah of small things like, who you want to preside over your funeral, who you don't want to attend your funeral if they're going to cause a problem or something like that. So you can put a lot of things into a wasiyah. These are among the things that you can add to it.
Got it. Dr. Hassan, did you have something to add there?
I'd say that, in terms of organ transplantation, so the way that it works is if someone who is listed on their driver's license as being a donor, and I've seen the same rules applied in Texas, Pennsylvania, and in Washington State. If they've listed as, yes, they're an organ donor, they are going to be eligible to donate their organs if all the other criteria are met. If they have not said that they're an organ donor, whoever is the surrogate decision maker will then be approached at that time and then asked. I do not know if, say there's a surrogate decision maker, say someone's spouse or kids or parents are making that decision on their behalf.
So you're saying in the case of brain death, then the surrogate decision maker would now make a decision about organ donation.
Right. Or there's also, in the case of, like, say, cardiac death, what can happen sometimes is if someone says this is a not survivable injury, they will not, you have the, we're going to withdraw life support. What happens very, very rarely that someone actually meets this criteria, but when we say that they're alive they're only alive because they're on this breathing machine, on these medications, we're going to turn off this breathing machine and medication because we do not think this is a survivable injury. At that time, someone not from the medical team, so I would never do this, but someone else from may approach that family and say, listen, he is eligible for organ donation if after they turn off all the medication and take out the breathing machine, he dies within 30 minutes. Is it okay if we take his organs then? So someone may approach you at that time, okay, even after cardiac death. And so the surrogate decision maker at that time may have to make a decision and say, I'm okay with this or I'm not okay with this on behalf. And I do not know if you're allowed to specify at that time. I imagine if you have an advance directive and you specify that you are an organ donor under these specific situations, I'm not sure if the organization that is in charge of allocating organs, if they're going to respect those wishes or not. But I think that's a reasonable way to say I will only donate if all of these things are met. I think that's a
so you could put that into your will, and then your surrogate decision maker could decide that.
As far as I know, yes. I have not. Yeah, as far as
so they could be the ones who have the final release. So if they feel comfortable, then they could release it.
They will have the final release if your driver's license does not specify that you are an organ donor. I do not know if they're allowed to put stipulations in the state of Washington on we will only donate under these situations. I don't know if that's allowed or not.
Got it. Sobia Moga, she's a doctor. She says DNR form does not have option for organ donation. Is that what you're saying, Sobia? I didn't get it because you put. I'm not sure if that was a statement. Okay, it does not. Yeah, it does not have any area for organ donation. So Hale says donating while both parties are alive, say per kidney. What is the ruling? So Hale, can you clarify both parties, as in the donor and the recipient, both? Is that what you mean?
Yes, yeah, where both parties are still alive.
Yeah, there's no problem with that. According to the majority of fatwas, right? There were the three main ones that were opposed to it, but the vast majority of scholars have said yes. The Fiqh Council have said yes, and my personal opinion is that it's fine.
Got it. And what happens if you said yes? Someone is asking, what happens if you said yes on the DMV application? Does the state automatically get the right, or does your family have a say on what happens next?
The family is not allowed to overrule the decision that you made prior. So a surrogate decision maker is allowed to make decisions on your behalf. But if you've already made that decision, then you are the primary decision maker, and they respect the wishes of the person who made the decision, and they would not defer to a surrogate decision maker.
So because the conditions cannot be stipulated when you check that box, and that seems to be the main way to do it, other than putting it in your will and then letting your family decide. What does that mean for the average person?
Sheikh Mustafa, do you want to take that one?
Can you repeat that?
So for the average person who's making this decision whether to say yes or no on the DMV, they can't stipulate these conditions that the Fatwa Council has made. So then what should they do?
Yeah, so if the conditions cannot be met, then basically the Fiqh Council has a no opinion stance because they've not concluded on brain death. So they're basically saying that since we don't have a conclusion, if you're confident in the system, if you're convinced of it, you can do that. If you're not convinced of it, you think, we need more research or something like that, we can't give you an official position. So I can tell you what happened in the Fiqh Council is that several members of the Fiqh Council actually had it on their license. And after we concluded the fatwa, they actually went and got it removed because they didn't realize, they had not researched this issue themselves in much detail. They just looked at the fatwas. When we were presented with the information, we had Dr. Asim Padella with us. We had the two main national organ donation network organizations with us. And after going through it, several of them did remove their thing, realizing that they wish there was a possibility to put the conditions that are going to be taken into consideration. But the likelihood of that, for you to actually register that, what is the DMV going to send it where? Where are they going to send the conditions? And how are they going to apply that in a state of emergency? They basically look at your ID card and you either are or you're not. You're not going to have like some place where they're going to be checking to see like there's a database of conditions or something in many states. So if that system existed, that would solve the problem. But I don't know if that system exists. And the system needs to exist and it needs to be implemented.
Was the primary, if you don't mind me asking, was the primary concern the issue of brain death not being considered like to be actually dead according to Islamic principles? Is that what the primary concern was?
There was two. So one is the handling of the body, whether it's being done properly, and the second one was brain death. So they abstain on brain death. The handling of the body, they said that's something.
So would you have to look at the standards of the state to find what the usual handling of the body is, or does it go down to the hospital system? Or
see, I again, that is something you can't put a burden on the average person to do that, right?
Yeah.
That's something that we were even unable to do, right, as a council. So the average person is really not going to be able to do that. So if they're going to make a personal decision, then that's what they should be doing ideally, right? So if they have confidence in that and there's, not cases like that taking place, then yes, it would be permissible. So that was one of the issues. The second issue was the issue of brain death, which they, again, keep in mind that the majority of fatwas from the 80s and the 90s were saying perfectly fine. Brain death is not Brain death is death, just exactly like what the good doctor said. But what happens is that there was an interesting paper in 2007. It basically someone looking at it's called Facilitating Organ Transplants in Egypt, an analysis of doctors' discourse in the journal Body and Society. All right, it's at 2007. So it says, when we and our professors speak to the muftis at the Darul Iftah in Egypt, they say that it's halal, but it leaves so much up to the doctors that we're not certain about. So basically what's happening is that the doctors in Egypt go to Darul Iftah of Egypt, the fatwa house, and they get the fatwas, but they leave it up to the doctors. The doctors come back and they say, but we don't know, we don't know the answer to this question. We're asking you to help us define the answer to this question. So what's happening is the doctors, the people, the medical experts are asking the sheikhs, you define what the definition of death is, and the shuyukh were saying, we leave it up to you to define what the medical aspect of death is. The problem is that this is a question of philosophy. This is not a question, what is the definition of death? Death is a process, right? Just like birth is a process. Abortion is an issue because it's a philosophical / religious question of when does a person actually become alive? Mm-hmm. Right? So the whole 40 days and 4 months and Catholic Church and all of that stuff, and whether the sperm is actually fertilized, the embryo or not, whether the morning after pill is considered conceptual as, bringing into a life and all that stuff. Mm-hmm. So that's a philosophical question. Death is also a philosophical question. And what happens is that you have a group of people saying, well, the medical community should decide. Another group saying, no, but the religious people should decide. And what's happening is which authority is going to actually decide. One is putting off on the other. The reality is it's a philosophical / religious issue that needs to be defined, incorporating both groups of people to come to that determination, right? That's why DNR issues are different than the idea of brain death, because there's a more clear conceptualization of when you can stop giving life support, when you can disconnect life support and something like that. There's many different concepts which has come out. When it comes to brain death versus, whatever other definition of death is, it's not at the level of sophistication or development in the discourse right now. So that's why the Fiqh Council abstained.
Got it. So if someone checks the box, if someone checks the box saying, you know what, I'm okay with it, checks the box, their organs get donated, it saves a life, will they have reward or have they done something wrong?
So we hope that if they're fully convinced that they're following a fatwa of a scholar or an organization that gave them the green light to do so, we hope that they're not going to be held accountable, right? That's what we can say. But it's not just like individual level and simply say, you know what, I don't care what all these other people think. I don't care what anyone else says. I know this is the right thing to do. And the basis for that is what? Just your own personal opinion without, checking it with anybody else. So I think this comes down to, it's almost like the fatwa on, where do you hold your hands in prayer? Or like, are you going to skip, are you going to wipe under your hijab with one finger because you believe Imam Shafi'i was right? Or are you going to use your whole hand, when you're in the bathroom? So it's kind of like that. When there's a difference of opinion among scholars, the same way that the scholars have to use their ijtihad to try to figure out, ijtihad meaning their utmost best to try to figure out what is the correct opinion. And inshallah, Allah is not going to hold them accountable for trying their utmost best. The individual is also supposed to use their utmost best to decide which group of scholars they actually trust, not just simply by fatwa shopping and saying, I'm just going to go with whatever, feels the best for me. It's not about what you feel is the best. It's what you think. What did Allah and His Messenger truly intend to do in this particular instance? And that's where you follow the scholars that you trust.
Got it. Okay, so there's a few more questions rolling in here. So let's try to keep the answers. I know it's a very deep topic. Obviously, it's hard to keep the answers.
There's one thing that Sheikh Adam, if I could follow up real quick.
Go ahead.
I would say that there's, I agree with Sheikh Mustafa completely. There's a lot of philosophical, we can keep people alive with their heart stopped now. We can keep people alive. Where does life stop and where does that end? I would say that when it comes to an actual brain death examination, I think that the medical opinion is clear that brain death is death. From my perspective. From Sheikh Mustafa may have more overall, overbranching, but in my belief, there's a lot of gray area between there. But for me, there's a very clear line. When you pass the brain death, that's no brain function. If I removed your life support, you would die very quickly. So for me, it's a very black. When it comes to brain death, to me, it seems like a very black and white matter. And once again, I'm not saying that that's necessarily true, but being an intensivist and seeing this on numerous occasions, to me, it's a very black and white matter. That's just my personal opinion.
Okay, so we do have some questions.
Do you want to answer the questions from the emails that we got?
Yeah, I can pull those up as well. Do you think we can do about 60-second answers?
Yes, I can do that.
Okay. All right. So we'll start with the ones that are here, and I'll pull up the email ones as well. Is it okay to donate bone marrow for bone marrow transplant?
Yes. See, 1 second.
Great. Jazakallah khair. Also, the next one here, donating your body for cadaver use in a classroom environment.
No.
Could you expand?
Yeah, I'll explain. So the thing is, it's based on need. So the thing is, yes, there is a need for people to train to become doctors, and medical schools use actual human bodies to experiment, or not experiment on, but to train on, which is going to obviously help them in a way. But the argument that there's no potential alternative to that, which would be almost to the level of being as effective as that, has been made. So if there's not, if there are alternatives, even if they cost more money, then utilizing human bodies for that is definitely in the category of disrespect to the human body without necessity. And that's why, unless there's some actual necessity, or they couldn't use some other type of body, that would be an exception to the rule. Based upon what I've seen and what I've researched, I know this is the standard practice, obviously. So are you allowed to be in a medical program given the fact that there's no alternatives? The answer is yes, you can be in that program. But if you started your own medical school and you had the ability to do something different, if you could provide an alternative, then the alternative should be there, and you're not allowed to use human bodies. So if you can't use them, then you shouldn't be able to give your own body without necessity.
Okay. All right. Question here: are Muslims allowed to accept an organ from someone who is brain dead?
Yes.
I guess for me, it's like, so we can accept from someone who is brain dead, but we can't give it if we are brain dead.
That's the question we're not saying that we can't give it. So the Fiqh Council abstained. So they're not saying a yes, and they're not saying a no. And I know obviously this is something that needs to be done like ASAP, right? This is something that needs to be concluded right now. But what we're trying to avoid giving a fatwa and then changing it 5 years later, because this is what happened with the previous Fiqh Council. This is what happened with many issues. So we're trying to avoid that. But let me answer your question. So this is exactly what the Islam hating industry was saying in the UK. What kind of Muslims are saying that, well, we're willing to accept organs, but we're not going to give them unless these conditions are met, right? So you say, well, that's hypocrisy. Well, the difference is that why would you be allowed to accept them but not give them? It's like money that's earned through riba, or like, let's say somebody's selling pork. So when they're selling pork, they've made their money. Are you allowed to take that money from them and transact with them? If they engaged in something that is forbidden in terms of a transaction or whatever it may be, you benefiting from the effect of that transaction is not you aiding in the transaction per se, or is something disconnected from the transaction itself, right? So that's where the fatwa was based on, that you could be taking it, but you cannot be giving it in the context that it's not allowed.
Okay. So are there other councils that have decided on this issue?
On the
issue of
brain death or on giving?
On brain death.
On brain death. So like I said, the old fatwas in the 80s and the 90s, all of them basically just gave a blanket statement for organ donation without going very in depth on the brain death issue. And they said, well, if the doctors say brain death is death, then we just go ahead and accept it. So what's happening is those councils are reevaluating now in the light of later discussions on the concept of death now. So everyone is kind of rethinking the whole process.
Interesting. Okay. Alp says, I think I'm even more confused than before now. What I'm hearing is decide for yourself. Is that correct?
Not exactly. So let me give you the short answer then. The short way is this. If you have a scholar or a group of scholars that you trust, and these are the people that you go to for all of your all of your opinions, generally you practice your Islam according to that. If they're telling you that it's okay, then you go ahead and do it. And if they're telling you that no, you should avoid it, then you go ahead and avoid it. I'm here as a researcher to be giving you a detailed explanation, which they may not have time to present to you in depth. So this is one of those issues in Islamic law that is disagreed upon by the scholars for the reasons that I presented. My goal is to make you understand why there's a disagreement and why people, why you don't have one clear-cut answer across the board, and why your trusted local / trusted scholar would be giving a different opinion than somebody else, right? So if you're confident in that person's opinion, and you're confident that they have the research and they have the understanding of deciding what this position is, then inshallah the burden is not going to be on you. The burden is not going to be on you that you gave this opinion. Yes. And Sheikh
But what
Adam,
happens if you trust the Fiqh Council of North America?
exactly. So if you trust, good questions. If you trust the Fiqh Council of North
We
America,
use you guys for our Ramadan. For the
I was just going to
starting.
mention that. This is exactly like the moon, when do you start Ramadan issue, right? It's the same thing. If you trust AMJA and you trust the Assembly of Muslim Jurists of America, then you're going to be following the sighting. And if you trust the Fiqh Council on moon sighting and all that, you're going to be following, them for Ramadan. You may follow them for this. If you trust Fiqh Council, then this is basically what they're saying, is that we have tawaqquf, we have abstained on the position of on the issue of brain death for now, and we believe that there is certain due diligence that's not being done when you sign up on the ID card in most states, if not all states.
Okay. All right. Okay, so let's move on here. So there was a question that I got via email. I think one of them you've answered already, which is, for scholars who say it is not permissible in Islam, would it also be that one can't save their own life by getting a transplant organ procedure? So like Mufti Shafi Usmani and Sheikh Sharawi, who said that it's not permissible, to them, is it also that you can't save your own life?
No, for them, they don't even accept it's just the whole
no transplant, no either way. Okay.
And in fact, there was one member of the Fiqh Council who had the same position. But he deferred and said, I'm not going to voice my objection. I'll just go with the council. But personally, on a personal level, he believes that it's not allowed at all.
Okay. And actually, before, I know some people are dropping off now because, just for time's sake, could you tell us a little bit about where people can find you if they want to learn more, if they want to follow your work at the Fiqh Council and also at the California Islamic University?
Sure. So I do have a longer version of this lecture on my website or on my YouTube channel. The channel is Mustafa Umar on YouTube. I also have a website, mustafaumar.com, where I put some of my articles and stuff like that. I also have another website called askthescholars.com, which is like a fatwa website. It's still in beta version, but it's developing. And then California Islamic University is a program where we have 2 years program with 22 different classes where people can take it online or in person. And the website for that is calislamic.com.
Okay. Jazakallah khair. Jazakallah khair, Sheikh Mustafa. Do you have some more time to continue some Q&A here?
Sure.
I know it's getting late there, so we'll try to end in the next few minutes here, inshallah. There's 2 questions on the Slido. Does going to country of origin to get an ethnically matched organ dramatically increase chance of success, assuming similar medical facility? I suppose that's for Dr. Hassan.
Yeah, it could. If you're having difficulties finding But I'll tell you that, the science for doing this is pretty complex. There's not a lot of countries that are doing a really good job. I know I'm originally from Pakistan, and I've seen they're starting things over there. I'm familiar. There's a guy named Dr. Saeed Khan who started an institution and stuff over there. So you may have better success finding someone if you're having a hard time finding someone who's matched well. But that's going to come with its own, set of issues and stuff like that. When I was in Houston, there was actually people that would be sent from Saudi Arabia that were sent from the government because they did not have very developed, liver transplantation programs there. So they would be sent to Houston under the government's dime to pending transplants and things like that.
Okay. Where can we find accurate and specific information about Washington state rules for organ donations? It looks like a follow-up session is needed based on the Washington rules. Any ideas from either of you on where to find such information? Google?
I can try to find out which organization it is that coordinates. I think it's like Life Gift or something like that coordinates organs. So I don't know if they're going to have better, but I could try to find out and follow up with you, Sheikh Adam.
Okay, sounds good. And then we can send it to those who have registered here. How is it different donating organs after death compared to donating while alive? I think we answered this. We talked about this in the presentation. When it comes to ghusl, what is recommended? Would it happen before or after the organs are donated?
It would happen after. And again, the national transplant organizations, they basically have a policy, from what I've seen, is that they say when you do donate your organs, they will return your body so that you can have an open casket funeral. So it's very clear on their website what their policies are. And
but there have been some horror stories.
There have been horror stories, right? So it's happened where that didn't take place. But officially, their position is that you will get, you can do an open casket funeral, and that's not going to be a concern or a problem. Now, again,
would you say the vast majority are able to do that?
So I can't say that, but that's what their website is saying. So assuming that it's correct, I would assume that they wouldn't make such a claim if it wasn't correct. So probably the vast majority are, right? So there's just probably some really bad horror stories. Something went wrong there, so a few lawsuits here and there, but that's their general policy. So the general policy is not that they're going to be messing up the entire body. So based on that, if you can have an open casket funeral without, I haven't looked into the details of what that entails because they're usually wearing a suit and tie and all that stuff, but probably ghusl would be perfectly fine afterwards. So if that's the case, the ghusl would be done afterwards.
And would that be similar, Sheikh Mustafa, to like an autopsy? What's your position or the position of the council on autopsies? And do you think that's can overlap to some degree?
Yeah, very similar to autopsy. Yeah. So when an autopsy is needed, it can be done, and then the ghusl is going to be done after the autopsy is completed. So I've done ghusl myself on autopsy body. It was not pleasant, but it is stitched up, it's sewn up, and it can be done, and there's no problem with a little bit of water getting inside or something like that. It's mostly stitched up.
And having participated in organ procurement operations, I can say that's definitely a goal of the surgical teams to make sure that, the person is returned in a way that the family can, view them afterwards and spend time with their body.
Yeah.
Jazakallah khair for adding that from your personal experience.
Yeah.
Sarah says, well, what happens if you die in another state or country? Are you still considered a donor if it is stated as such on the driver's license?
I'll say from my personal experience, if I can jump in, whenever someone is medically in a position that they cannot speak for themselves, we always try to find out, I've never met that person before. They come to my ICU and they have a breathing tube. They're not able to express their wishes. My first goal is to figure out, did they leave any prior documentation of what their wishes would be should they end up in this situation? So if I saw an organ transplant, I don't know how legally binding it would be, but if I were to see that, to me, it would seem like that person's expressed wishes. And that would be the same for anything else. If they said, if I end up on life support and after 2 weeks there's no good chance of my recovery, then I would always try to look for what their wishes were. Once again, I'm not sure what the legal, I am not the person as the doctor taking care of the patient. I am not the person legally making those decisions. It's another organization. As a doctor taking care of that patient, my only concern is that patient. If they were to become an organ donor, that would be another set of doctors so that there's no conflict of interest, so that there's no thinking that, oh, maybe this doctor is letting me die early so that they can take the organs. That doesn't happen at all. That's a separate team entirely from what I'm doing for the patient that's there in front of me. But my understanding is most likely it would probably be legally you would become an organ donor, but I'm not sure 100% if that's true or not.
Okay. All right.
Question to Hassan, actually. So, Hassan, I got a question for you regarding the sale of a part of the body to for-profit organizations. Can you comment on that?
I was not I will say, so even if you do like a blood donation, right? If I'm doing a blood donation, I'm not getting money for it, but it's like a multi-million-dollar industry at the same time. When I participate in organ transplantations, I've done it both from a procurement side, being in the operation. So I do anesthesia. So when they're actually transplanting the organ, I am considering mostly major organs, right? So liver, kidneys, lungs, heart. I've participated in the anesthesia for corneal transplants as well. I've never even thought about what they're doing with like adipose tissue and hair and all of those sorts of things. I've honestly that's never come to my mind. That you mentioned that it's, being sold for profit to for-profit organizations strikes me wrong. Like it feels wrong, it feels weird. And I agree that there should definitely be a way to opt out of that and say, look, we don't want parts of my loved one to be used for profit. At the same time, in my mind, I'm thinking if it's helping someone, is there an argument to be made? I don't know. It seems like a little bit of a gray area. And to be honest, I've never considered that was occurring before.
All right. Jazakumullahu khair, both of you, for your time tonight. I know it's busy with the kids and everything. Everyone else, please check out California Islamic University. Please check out Sheikh Mustafa's websites and his YouTube channel, inshallah, for more information on this. And we will see you all, inshallah, next time. Next week, inshallah, we have a program on entrepreneurial journey by Brother Sayyid Hamid, who was a former board member here at MAPS. He's got his own startup called Sophie AI. I think Brother Haider also works with that. And he's going to also have one other person. There's going to be a panel. Two entrepreneurs are going to discuss their journey and how that relates to their work in the tech industry and so on. So interesting conversation in the community. So we'll be having that next week. And then after that, in April, right before Ramadan, we have a presentation from our small business network. And then, of course, the week before Ramadan, we're going to have a presentation on Ramadan. So we have a busy calendar. Inshallah, we will see you all next time. Jazakumullah khair for joining us today. And if you missed anything, feel free to catch the recording. We'll put it up on our channel, inshallah, once it's ready. All right, everybody. Jazakumullah khair. Wassalamu alaikum wa rahmatullahi wa barakatuh.